This medication is used to temporarily treat symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis, bronchitis. It helps relieve stuffy nose, sinus, and ear congestion symptoms, as well as pain and fever. It also helps with watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It is important to note that this product should not be used to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor, and some forms of this medication are not recommended for use in children younger than 12 years. Always follow the dosage directions carefully to decrease the risk for serious side effects, and do not give this product to make a child sleepy. Be sure to ask your doctor or pharmacist for more details about using this product safely. It is also important to avoid giving other cough and cold medications that might contain the same or similar ingredients, and to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Theraflu nighttime severe cold cough 25 mg, 10 mg, 650 mg powder packet, make sure to follow the directions on the package label if it's an over-the-counter product, or as directed by your doctor if it's prescribed. Take the medication by mouth with or without food, and if you experience stomach upset, consider taking it with food or milk. Stay hydrated by drinking plenty of fluids, unless otherwise directed by your doctor, to help loosen mucus in your lungs. If you're using the liquid form, use a special measuring device to carefully measure the dose and shake the bottle well before each dose. For extended release capsules, swallow them whole and don't crush or chew them. If you're taking the chewable form, make sure to chew it thoroughly before swallowing. The dosage of Theraflu nighttime severe cold cough 25 mg, 10 mg, 650 mg powder packet is based on your age, medical condition, and response to treatment. Do not increase your dose, take it more often, or use it for a longer time than directed. It's important to tell your doctor if your condition lasts for more than 1 week, gets worse, or occurs with certain symptoms like a persistent headache, rash, or fever lasting more than 3 days. Depending on the symptoms being treated, you may need to contact your doctor earlier than 1 week, if they last or get worse. Always check the specific package label for when to contact your doctor. Some common side effects of Theraflu nighttime severe cold cough 25 mg, 10 mg, 650 mg powder packet may include drowsiness, dizziness, blurred vision, upset stomach, nausea, nervousness, or dry mouth/nose/throat. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. If your doctor has prescribed this medication, they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, including mental/mood changes, such as confusion, hallucinations, shaking, trouble urinating, fast/slow/irregular heartbeat, or seizure. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Remember to always consult your healthcare professional for medical advice about side effects. Acetaminophen is an ingredient in Theraflu nighttime severe cold cough 25 mg, 10 mg, 650 mg powder packet. It's important to not take more than 4,000 mg, 4 grams, of acetaminophen a day. If you have liver problems or are giving it to children, you should take less acetaminophen. Make sure to check the labels on all your medicines to see if they contain acetaminophen, and ask your pharmacist if you are unsure. If you take too much acetaminophen, seek medical help right away, even if you feel well. Symptoms of an acetaminophen overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Also, it's important to avoid daily alcohol use, especially when combined with acetaminophen, as it may damage your liver. Before taking Theraflu nighttime severe cold cough 25 mg, 10 mg, 650 mg powder packet, it's important to talk to your doctor or pharmacist if you have any allergies or other health conditions. This medication may make you dizzy or drowsy, so it's important to avoid alcohol and marijuana while taking it. Some brands of this product may contain sugar, alcohol, or aspartame, so be cautious if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit/avoid these substances in your diet. It's also important to talk to your doctor before using this medication if you are pregnant or breastfeeding. And remember, children and older adults may be more sensitive to the side effects of this drug, so it's important to take extra caution if you fall into these age groups. Always consult your doctor or pharmacist before using this medication. It is important to be aware of potential drug interactions with Theraflu nighttime severe cold cough 25 mg, 10 mg, 650 mg powder packet. Some products that may interact with this drug include ketoconazole and levoketoconazole. It is also important to avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Additionally, it is important to inform your doctor or pharmacist if you are taking any other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. The ingredients in this product are available in many prescription and non-prescription products, so it is crucial to check the labels on all your medicines to avoid potential side effects. Furthermore, it is important not to use any other antihistamines applied to the skin with this medication, as it may cause increased side effects. Lastly, this medication may interfere with certain lab tests, so it is important to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much of this medication and is experiencing serious symptoms such as passing out or having trouble breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing eyes/skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. If you have any concerns about potential overdose, seek medical help right away. Be sure to follow all medical and lab appointments as directed by your healthcare provider. If you forget to take this medication at your regular scheduled time, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your usual time. Don't take a double dose to make up for the missed one. It's important to store Theraflu nighttime severe cold cough 25 mg, 10 mg, 650 mg powder packet at room temperature away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid forms of this medication. Keep all medications away from children and pets. When it comes to disposal, do not flush medications down the toilet or pour them into a drain unless instructed to do so. It's important to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.